President Trump has been accused of putting his own Secret Service staff at risk after leaving the hospital where he's being treated for COVID-19 to drive past supporters and wave. A White House spokesman said precautions were taken to protect the president and those around him, including PPE, and that the outing had been cleared by the medical team as safe. But one doctor called it unnecessary political theatre and said those inside the hermetically sealed car with Mr. Trump would be forced into quarantine for 14 days. Mr. Trump has been at the Walter Reed National Military Medical Center since Friday. We'll take you there live in a moment. But first, let's bring you right up to date with our North America correspondent, David Willis.
The US government's medical experts advise coronavirus patients to stay in their room and only venture out if it's medically necessary. Not this patient. Accompanied by Secret Service agents in protective gear, President Trump embarked on a slow drive around the Walter Reed Medical Center to wave to supporters who've maintained a vigil there since he was admitted 3 days ago. Great patriots, in his words, and whilst the president himself was wearing a face mask, few of them were doing the same. He teased the trip on Twitter after paying tribute to those who've been treating him.
It's been a very interesting journey. I learned a lot about COVID. I learned it by really going to school. This is the real school. This isn't the let's read the book school. And I get it, and I understand it.
But some think he hasn't learnt enough. An attending physician at Walter Reed, Dr. James Phillips, described the drive-by as an act of political theatre that could cost the Secret Service agents involved their lives. That the irresponsibility is astounding. Following several days of confusion and contradiction surrounding the president's condition, further details have emerged. Despite saying that his condition continues to improve, his medical team confirmed that his blood oxygen level dropped twice in recent days and that they gave him a steroid typically recommended only for the very sick. Pressed about how their information had conflicted with that from the White House, the president's personal physician acknowledged he painted a deliberately rose-tinted picture of his patient's condition.
I was trying to reflect the upbeat attitude that the team, the president, that his course of illness has had. I didn't want to give any information that might steer the course of illness in another direction, and in doing so, it came off that we were trying to hide something, which wasn't necessarily true.
What is true is that the president is being aggressively treated with a cocktail of drugs, as well as an experimental antibody therapy and a course of remdesivir, which curbs the virus's ability to multiply. These include dexamethasone, a steroid tested in the UK. It works by calming the immune system, but is rarely used on patients who are experiencing only mild symptoms of COVID-19. Indeed, guidance from the World Health Organization specifies that dexamethasone is recommended for the treatment of those with severe and critical COVID-19, and particularly those on ventilators. And despite being on a 5-day course of remdesivir, the president's doctors say he could be leaving hospital later today. With the president grounded, his Democratic rival remains on the virtual campaign trail. 5 days after spending 90 minutes on a debate stage with Donald Trump, Joe Biden has tested negative for the coronavirus. Senior Democrats say they hope the president's diagnosis will change his attitude towards the coronavirus. But that remains to be seen. David Willis, BBC News, Los Angeles.
Let's bring you right up to date and speak to Gary O'Donoghue, who joins us from outside the Walter Reed Hospital in Maryland. Good to see you this morning, Gary. There's all this confusion still about the president's health. Yet if we look at Twitter, in the past 45 minutes or so, we've seen, I counted 10, but in the last 30 seconds there's been another. So that's the 11th tweet from President Trump this morning. Wonder what we can read into that.
Well, also not one real mention of his illness in any of this sort of blizzard of tweeting this morning. I think trying to demonstrate that he's back on the sort of campaign trail, despite the fact that he's in a hospital behind me, trying to demonstrate that the election is still on, pressing all those buttons on taxes, on guns, on law and order, on the success of the stock market, trying to, I think, persuade his supporters that he's fighting fit, as I say, even though he's still in the hospital, because over the weekend, as you say, a lot of confusion about his medical condition, some details emerging that he was sicker than we were led to believe he was for a period of time. And of course, depending on when he actually got diagnosed, and that's still unclear, the worst could still be ahead. Because as we know, potentially the worst time in this illness is maybe between 7 and 10 days in. And given his age and other issues around his health, he may not be out of the woods yet. So we'll see what the doctors have to say today. But I think here's a president trying to indicate to his supporters, indicate to the country that he's absolutely fine.
Given all of that, Gary, it does seem odd that he may in fact also be discharged today.
Yeah, there's been talk of that. There's nothing official coming out on that. I mean, he is still having these treatments, which, it's worth remembering they're given intravenously. Now, it does seem that there is some sort of capacity to give those sorts of intravenous treatments at the White House. They do have a much more extensive medical unit there than you might actually think, and he had some of that stuff before he came up here to Walter Reed. So that potentially could happen. But of course, if you suddenly take a dive in terms of your symptoms, then you want to be in the best place possible, and this is one of those best places. So whether they'll take the risk of moving him back to the White House, because of course the worst possible disaster would be have to do that trip back into DC and then all the way out again if things got worse.
Gary, thanks for joining us from outside the hospital. Well, it's not just the president's illness that's making the headlines. 2 Republican members of the Senate Judiciary Committee also testing positive for the virus, raising questions about the timing of the Supreme Court confirmation hearings for Judge Amy Coney Barrett and whether additional senators may have been exposed. The Republicans say the Senate Judiciary Committee will convene in a week's time to begin the hearings. The Democrats had complained, saying that the decision to go ahead with the confirmation hearings threatened everybody's health in Congress. And some news from here in Europe as well. We are hearing that the President of the European Commission, Ursula von der Leyen, has confirmed that she's put herself into quarantine. She sent out a tweet saying that she had come into contact with someone who has tested positive for coronavirus. She has tested negative and will be tested again later today.